Thank you, Last Deputy Ward, for tabling this motion. Put simply, we cannot continue to ignore the reality of mental health illness. We do not tolerate waiting lists for passports, driver's licences, or indeed vaccinations. Yet for mental health treatment, waiting lists are normal and accepted. John Farley, Chief Executive of the Mental Health Commission last month, identified the issue at the centre of today's motion. The pandemic has highlighted the continuing underinvestment in our mental health services, increased waiting lists, over-reliance on GPs and communities to provide care, and assigned money going unspent. Thanks to figures secured by the Social Democrats co-leader Roisin Shortall, we know that as of December, there are 2,736 children waiting on an appointment with community CAMHS. Of this, there are 448 in the Cork-Kerry region, with 98 children and adolescents waiting over a year. Unfortunately, the HSE does not have national data on waiting lists for adults and older adult mental health teams, which is an issue in itself. This motion articulates many of the major issues in the state's response to mental health, especially at a time when community and voluntary frontline services are experiencing an unprecedented demand for mental health services. There are two particular issues that I want to focus on today. In February, I raised the shocking situation whereby no funding was allocated under the National Eating Disorder Treatment Plan for 2020, and that none of the 1.6 million allocated in 2019 was spent. Responses to my parliamentary questions revealed that the decision to temporarily pause the nationally planned developments of eating disorder services was made for operational reasons rather than clinical, and that funding was diverted to meet existing demands to provide additional clinical supports such as agency staffing. Minister, we need clear assurances that this will not happen again. Bureaucratic decisions cannot be allowed to affect the treatment of vulnerable groups. My colleague Gary Gannon has added an amendment to ensure dedicated ring-fenced funding for eating disorders annually, and to ensure there is a community eating disorder team deployed in every community healthcare organisation area. I ask all members to support this vital amendment. In February, I also highlighted that eating disorders, which disproportionately present among young women, are the psychiatric conditions most associated with mortality. Minister, you assured me then you were aware of the issue and that you were working with the HSE clinical programme leaders to spend the money this year. However, in the meantime, there has been several cases of young women having serious difficulty accessing appropriate medical care for severe eating disorders. These cases indicate that there is still a significant gap between government's intention and on-the-ground healthcare services for people who desperately need them. The HSE currently provides 3 inpatient beds for eating disorders. 3. People who desperately need care simply cannot get it. If you haven't read the piece covered by the Evening Echo on one woman's experience, I hope you will today. And Minister, I'm begging you to please intervene and do something about this. Secondly, I want to raise counselling services. The system of professional, low-cost, community-based counselling services in Ireland have had their funding cut by 50% since 2011. These agencies are frontline community, voluntary and non-profit agencies who have continued to deliver counselling service throughout the pandemic. State agencies, including TUSLA, CAMHS and Gardaí, often refer people to these counselling services, and yet their funding does not reflect the crucial role that they play. This sector represents incredible value for money. In 2018, member organisations of the Association of Agency-Based Counselling and Psychotherapy in Ireland provided over 70,000 hours of therapy for 2.8 million. This community-based non-for-profit sector needs their funding restored and needs a commitment to multi-annual funding. In addition, the government must make a commitment to review the current model of funding of Section 56 to 59 TUSLA-funded organisations. I presume the motion's call for an emergency talk therapy fund for sessions in private systems will allow for funding to go to community-based and non-for-profit sectors also. If one of the proposers could clarify that in their closing statement, it would be greatly appreciated.
Thank you, Deputy. Moving on to solidarity.